News about the Omicron variant of COVID-19 certainly raising a lot of questions and more anxiety at this point in the pandemic. And so let's bring in Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio, to talk about what we know and what we don't know about Omicron at this point. Doctor, good to see you. Thanks for being here as always. When it comes to things like transmissibility, severity of symptoms, what is known about this variant?
We're still learning, so anything I say now could change when we get more data, but all reports so far point to this variant of concern apparently being more infectious, more easily transmissible, but so far apparently fairly mild. That's what's being reported in South Africa. They have noted there that a lot of their cases are in younger people, and that could account for why the disease appears to be milder there. And so we have to wait and see what will happen if some older people start to get it, if they will have more severe symptoms. But two take-home points are it appears to be more transmissible and possibly less severe than Delta.
Is there any indication right now whether the vaccines that we have will be able to handle this latest variant?
So I think there are encouraging early signals that the people that are getting sick enough to need hospitalization with Omicron are people who are unvaccinated. So yes, I think this is potentially something that will make unvaccinated people sick, but it's very likely that the vaccinated people will get away with mild symptoms.
There are still plenty of people who need that vaccination, even the first dose, but some people are on to the booster shots, their third dose. So who should be getting these boosters at this point?
Thanks for asking. That's a really important point for us to clarify for everybody in the public. Boosters, which means the third dose, which is being given 6 months after the second dose for the mRNA vaccines, those boosters are for adults. Those are not for children. Those are for people 18 and up as approved by the FDA.
Go ahead.
Do we know whether children are going to need a booster eventually?
Time will tell.
Okay.
With the booster recommendations for adults, that was based on watching for waning immunity and breakthrough cases with time, and we don't have that information yet for the children.
Doctor, I want to talk about South Africa in all of this. We talked to Pastor Andries Kutsea he's actually in Johannesburg right now, and he was talking about how they're viewing this whole thing. Are we seeing vaccine inequities play out here when you see it spread so rapidly in South Africa, a country that doesn't seem to be getting the vaccines that they need to inoculate their people there? Are we seeing that play out? And how does that affect even you and I here in the United States?
Yeah, there's no doubt that there's been a huge imbalance in our world of who's getting vaccine and who's not. And we should all care about it, not just because we care about our fellow human beings on another continent. We should care about it because an infection anywhere is a threat to people everywhere. And we saw that just within days of these reports from South Africa, the Omicron variant has already been reported in at least 23 countries, including Canada and including several states now in the US. So it doesn't take long with air travel and globalization for infectious disease to spread around the globe. So we have all the interest in the world in making sure that vaccine does get distributed equitably, because it's the fair and just thing to do for humanity, and also because it protects us here at home.
Yeah, we are really all in this fight together, whether you're in San Antonio or Johannesburg.
Agreed.
You know, we were out at a vaccine clinic earlier this evening, and people were still telling us there that they're just now getting the questions that they have answered. It's all about education for some people in terms of what they know about the vaccine, feeling comfortable enough to get it. And I know you're still getting questions. We are too. One of those, is the vaccine a live virus like we know some vaccines are?
Yes, I got that question just today in my own email inbox from someone who was worried about getting vaccinated with an mRNA vaccine when they're taking medicine that suppresses their immune system. They take Humira, and they wondered if the COVID vaccine would be dangerous for them because they heard that they weren't supposed to get live vaccines. So the COVID mRNA vaccines, they are not alive. Those are not live vaccines. And yes, immunocompromised people can get these vaccines. They do get them, and it's recommended that they should get them to protect them maximally from COVID infections.
Are you hearing anything else, any other common misnomers when it comes to the COVID or COVID vaccine and that you would like to dispel? I mean, things like, obviously we hear it all the time about fertility. We've tried to dispel that over and over here, but are there any other common myths out there that we need to separate the fact from the fiction on?
Many myths. One of the ones that I'm hearing over and over is a concern that people that are in ill health feel anxious that if they get this vaccine, it's going to somehow tip them over and make them sicker. And I've heard this from people who are suffering from diabetes, from people who are suffering from rheumatologic diseases, from people who are suffering from HIV. And what I tell these people is that you actually need to get the vaccine even more than other people, because if you were to get sick with COVID, your outcome would be far worse. And it's also true that those people's responses will not be as robust as healthy people, but that doesn't mean they should shy away from it. They need to go get vaccinated to give themselves the best possible chance in this pandemic.
You know, we've known for months, all of us have known that this virus mutates, and we know that we went through the Delta surge. It's really not a surprise that there's another mutation discovered, but certainly the news of it and its rapid rise in South Africa, it's raising that anxiety level again. And we've heard people say cause for concern, not cause for panic. So what is your message that people should be walking away with when it comes to this new variant and how we're seeing it affect people so far?
Put your masks on. Use the principles that you've been learning and practicing for the last almost 2 years now of washing your hands and using common sense when it comes to social distancing and planning events. Get yourself vaccinated. If you haven't had your second shot, go get your second shot. If it's been 6 months since your second shot, go get your booster. Get your kids vaccinated and keep everybody safe around you.
Are you concerned at all about what the next variant may be, or that eventually there will be a variant that our vaccines won't be able to take care of?
So I have little doubt that there will be a next variant, because it's just taking us a very long time to get the vaccines distributed around the world. We need to accelerate vaccination to shorten the time period where we all over the world are dealing with variant upon variant.
All right, so the message, get vaccinated, get the booster, do all the things that we all know we should be doing.
Right.
Dr. Ruth Berggren, thanks as always for your time.
You're welcome.
We have the tools. We'll be right back.